Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Hello and welcome. My name's Lauren, and I'm the Program Director with Cancer Support Community Atlanta. Cancer Support Community Atlanta provides free programs for anyone affected by cancer here in Georgia. We offer programs like we're doing today, an education program. We do nutrition, healthy lifestyles like exercise, yoga. We do physician-led education programs, fun social events, and so much more. Today, I'm honored to do an interview with Randalyn. Randalyn is with Allure Beyond Beauty, and she is a medical tattoo artist. We are going to do a program today on 3D areola tattoos. Randalyn's going to go over what it is, the who, what, when, where, and why. So thank you, Randalyn, for joining us today. Go ahead and kind of get started and tell us who you are.
Thank you so much for having me. I really do appreciate this opportunity. But thank you so much for the introduction. You said it very well. So I am a paramedical tattoo artist, specializing in 3D areola tattooing and scar camouflage. I am the owner of Allure Beyond Beauty, where we focus on helping individuals restore their confidence. And we just try to bring out the best in them and try to get them back to normal reality after life-changing events. So my passion for helping others has always led me to explore the paramedical tattooing industry. And, I just saw the need for specialized services like 3D areola tattooing and scar camouflage for my business. Services that are not just cosmetic, but also deeply empowering for people who have gone through surgeries or trauma. So knowing that I could use my skills to help breast cancer survivors feel whole again after a mastectomy was just rewarding for me.
Thank you. That's beautiful to hear. So tell us, what is a 3D areola tattoo?
Yeah, so a 3D areola tattoo, it's a specialized form of paramedical cosmetic tattooing used primarily for breast cancer survivors who have undergone mastectomy or breast reconstruction surgeries. The technique that I use, it just creates the illusion of the natural nipple and areola by applying pigments to mimic the appearance of an actual nipple. The process is a personalized process, and it's a well thought out service. I think it is very life changing for many women and men, giving them a sense of closure after medical procedures.
So they do look real. It's not like a flower or another tattoo, correct?
Absolutely. In fact, I get banded on my social media platform quite often because of the realistic look of it. So it definitely looks very much so real.
Well, so if they are blocked sometimes on social media, how can we see an example of what they look like?
Yeah. So again, I have an Instagram platform. I can be found at Allure Beyond Co. That is ALLURE Beyond BEYOND I do have 2 pages out there due to the reason it does look real, and I have to have a backup solution. But that page also takes you to my main page, which I just disclosed. My backup page is Allure Beyond Co, the number 2. I'm also able to be found on Google search engines. You could just type in Allure Beyond Beauty and it will provide an overview for that. And also I do have a website, and that is allurebeyondbeauty.co.
Perfect. Thank you. So that's where we can see some real examples of your work.
Exactly.
Awesome. So can you explain how you pick out with your client the color and the size? What does that look like?
Yeah, so this involves a personalized consultation for sure, and it involves several factors. One being the actual consultation. So we will talk to the clients about their preferences, their desired look, and any specific concerns that they may have. During that process, we also want to go over any type of medical history. Doing so, we just want to get an understanding of the medical conditions or treatment, because this can also help tailor the approach as well of the look of what color or either the size that we try to target. But determining the actual size, we will measure the dimensions of the existing breast or the reconstructed area, just to ensure a natural fit for the client.
Okay, so everything's custom, it sounds like.
Absolutely. Everybody that walks in, they are definitely customized. No one is the same. Even down to selecting the color. We always want to assess the client's skin tone and the undertones to select the pigments that will blend seamlessly for their natural skin. At times, we do ask for our client to provide a photo before or either, at the initial appointment, just to get a kind of sense of what they used to look like before surgery. But again, everyone is totally different because every surgeon does it differently, and you just never know what you walk into. So I always like to kind of get the heads up with a picture or something like that, just to kind of get a glimpse as to what I'm going to be dealing with.
All right, that makes sense to me. Does it hurt to get the tattoo?
The level of discomfort varies from person to person. Just the look as well. Again, everything is kind of different when it comes to this type of industry or this type of procedure. Since many clients have had breast surgery, some areas might have reduced sensation due to the nerve damage, making the process less painful. However, there are times where we have clients that have more sensitivity, and the procedure can cause a mild discomfort, but I do apply a topical solution to minimize any pain. We always strive to ensure our clients are comfortable throughout the entire process. And I always try to give a rating from my clients as to how bad the process hurts to them. And on a scale from 1 to 10, and 10 being the highest, I'm normally getting like 2s and 3s.
Okay.
So it's very minimal pain.
Okay.
Yeah.
So you will feel it, but it won't be the worst pain.
It won't be the worst pain. No, it won't.
Okay. Very helpful. How long does it take to get the tattoo if you're doing one or both?
Yeah, so ideally the session takes about 1.5 to 3 hours, depending on the complexity of the design that we're looking for, going for, trying to achieve, and whether we're going for a more dramatic look, a more natural look. I do have clients that want the heart areolas, and that takes a lot of drawing and stuff that goes into that. And again, it all depends on the customization that is needed to be done. Again, different surgeons perform different surgeries differently. Some are able to apply the nipple mound and not only have to do the areola. Some I have to completely start from the base up and do the areola and the actual nipple itself. So it just all depends. But the time factor does include the desired results of doing the consultation, applying the numbing cream, and doing the tattoo itself. But
Okay.
nothing over 3 hours I have not experienced.
Okay.
Yeah.
Very nice. And then how long does it take to heal?
Yeah, so the healing process takes about 7 to 10 days for the surface to heal, but full healing can take about 4 to 6 weeks. And during that initial healing period, the area may feel a little tender and the color may appear a little darker, but that's normal. And I always disclose what to expect up front so my customers are not freaking out or anything like that. And, as the skin heals, some peel and some flake, and, some of that stuff may occur, and the color will lighten to its final shade eventually after that 4 to 6 weeks healing process has been completed. But it is very essential, that, the aftercare instructions are followed for sure, because, you know, we want to try to avoid any type of complications such as like infections and stuff like that.
Okay. What is the care you have to provide afterwards to take care of your tattoo?
Yeah, so I mean, it's several steps that we need to kind of take into consideration. We want to try to keep the area clean and dry, and you know, apply the ointment that I provide at the end of each section. Excuse me, and always avoid sun.
Okay.
Sun exposure is definitely a big one, because I know a lot of my clients like to sunbathe, and wearing tight clothes is something that we want to kind of avoid during the healing phases. And
Okay.
we don't want to pick the scabs. Again, it will kind of peel and scab. Any wound that you get, it's going to come with the scab. So same thing. You don't want to peel it. Just kind of let it fall off naturally. And another big one, working out. Yeah, we want to kind of keep the area dry, and try to avoid excessive sweating as much as possible, because this will overall have an overall decision on the outcome of the results.
Okay. That all makes sense. So it doesn't sound like there's too many things to kind of take care of it once you have your session together.
Not at all.
Do you have to go back for touch-ups?
Normally, it typically lasts up to 2 to 3 years, depending on the factors like, you know, your skin type, the aftercare, if you adhere to the the whole list that we have, and the sun exposure. But over time, the pigment can fade, and so it tends to, you know, lighten up a little bit. And you know, I always encourage my clients that if you do experience or see that type of fading, definitely come back, you know, after a few years, and we can kind of like touch it up a little bit, or anything that, you know, you want to fix that you didn't like the first time. But definitely something that, you know, the proper aftercare, such as avoiding the excessive sun that we just mentioned,
Mhm.
and, you know, not too much moisture, it helps prolong the life of the tattoo.
Okay. Is the ink safe for women who have had a mastectomy or chemotherapy or radiation?
Yes, it is generally safe when applied by a trained or licensed professional. The pigments that I use are specifically formulated for cosmetic and medical tattooing. They're made from non-toxic ingredients, and you know, they're designed to be safe and absorbed by the skin. However, as some in any procedure, there are some risks of allergic reactions. Although it is rare, you know, it is important to disclose any known allergies or skin sensitivities during the consultation to minimize the risk. But here at Allure Beyond Beauty, we use high quality sterile pigments and equipment, along with the aftercare, the proper aftercare, and this helps ensure the safety, for the before and after of our clients.
Okay. Thank you kind of for covering, I think, all the nipple tattoo basics. So, if someone was interested, do you go to your physician's office? Do you go to a regular tattoo parlor? Like, how does someone find, if they're not able to see you, how does someone find a medical nipple tattoo?
Yeah, so some of their providers may have that type of information, at their reach at their office. I'm not sure, but typically their surgeon will direct them in the right location. If But I normally have not seen the tattoo parlor do this procedure. They actually been reaching out to me. It's quite funny because they was like, "Oh my God, you look so good," and I'm like, "You look good, like those tattoos." Because I don't actually tattoo like any portraits or anything. I just straight cosmetic and paramedical. So it's just it's the excitement thing to see and hear from an actual tattoo artist that they find enjoyment in my work. But I have not seen them go into the actual tattoo parlor for this type of procedure.
Okay, so you really need to just probably speak with your plastic surgeon,
Yes,
and
for sure. For
and they
sure.
can get you connected from there.
For sure. Because again, I think we're going to get there at the end, but insurance is always something that we want to kind of utilize if we have it available.
Okay, well, yes. So do you need a referral to get a nipple tattoo?
So, in some cases, you may want to consult with your insurance company, but this 3D areola is covered by the insurance. But yes, it is often covered by the insurance, especially when it's a part of a reconstruction following a mastectomy.
Okay.
And many health insurance plans do recognize it as a medically necessary procedure rather than a cosmetic one. However, coverage can vary depending on specific insurance plan and the artist and the clinic that's offering the service. I always tell my clients to check with their insurance provider just to confirm the details of the coverage and whether pre authorization is required. Some providers may only cover services performed by certain licensed professionals or within a medical setting. So that is something that we do, address to our clients just to make sure that that is something that they want to check into is if they want to utilize their insurance. So if they want to use their insurance, they want to keep in mind that this service cannot just be performed anywhere or by anyone.
Okay. So to recap, you go to your plastic surgeon, talk to them and see if they have a referral, see if it is billed with your insurance through their practice or outside, and then you suggest talking to your insurance company to see kind of like the who, what, where, like how to get it done, how it
Yes,
needs to be appropriately billed. But
exactly.
most of the time, women who have had a mastectomy, the 3D areola tattoo is covered by insurance.
Yes, yes.
That's fantastic.
If it's
Thank
followed by reconstructive.
Correct. Okay, so if it's the paramedical tattoo, not like if someone wanted a different image, flower or a heart, something like that,
No,
that
that
is
is
not
not
covered.
covered. That is
Okay.
not. Mm-mm.
Thank
It's
you for clarifying that, Randalyn.
um,
So anything else I didn't ask, or you think anything women should know that I didn't think about today?
I think one of the most important thing that we should disclose, how long should you wait
Okay.
before getting the tattoo?
Mhm.
It's generally recommended to wait about 3 to 6 months after breast surgery before getting this service. This just allows the time for the surgery wound to kind of fully heal and the swelling to subside and the scar tissue to settle. However, in some cases, the longer wait may be necessary, depending on the factors like the extent of the actual surgery or were there any type of complications like infections from the surgery. But at Allure Beyond Beauty, do not take anyone without a doctor's clearance.
Okay.
It just depends on the amount of time that has already transpired. We won't request a doctor's clearance, but within that 3 months to a year time frame, yes, we will definitely want to get a doctor's clearance just to make sure we have the consent that your skin is perfect enough for the pigment to be deposited.
Okay, makes sense. So the patient's responsible for talking with their physician to see if they're ready, having their skin checked, making sure they're healed and ready to go, and then they're ready to see you for the
Ab-
tattoo.
Absolutely. Absolutely.
Perfect. Well, thank you so much for joining us, Randalyn, and giving us some education. We
Yeah.
certainly appreciate it, and we hope everyone, if they have any interest in reaching out to Randalyn, is the best way to follow you on your Instagram or on your website.
Yes, either way, you can reach out to me. I'm always available. So, website allurebeyondbeauty.co, not .com, but .co. You can definitely send us a message there. One of my staff members or myself will reply if you have any type of questions. I also can be reached via phone if you have, if you want to call me. I always love to speak to you, but that number is 704-909-9467. And you can always Google search me and find me on there.
Well, thank you so much, Randalyn, and thank you to everyone for watching us. Please check out Cancer Support Community's website, cscatlanta.org, for all of our programs, whether they be in person, virtual, hybrid, or recorded. We appreciate you all, and thank you very much for watching.
Thank you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.